Good morning, ladies and gentlemen, and welcome to the fourth edition of Partnership for Action Against Tuberculosis, also called PAcT. Tuberculosis is curable. The treatment for TB is free, and yet India sees more of this disease than anywhere else in the world, and more people die in our country for something that can be controlled. Truck drivers, the population that Apollo works with closely, are highly prone to TB. The problem is that they are constantly on the move, and TB requires a referral for diagnostics and long term medication. We at the Apollo Tyres Foundation have joined the Jan Andolan for a TB free India for 2025. We are also committed to supporting the trucking community through creating awareness, helping diagnose TB early, and then helping our truckers stick to the treatment recommended. Sputum testing, regular awareness sessions, and linking patients who are found positive with directly observed treatment or DOTS is how we do it. PAcT started in 2020, and since then, over 500,000 people have been reached out through awareness activities. So far, close to 12,000 people have been facilitated for TB testing, and a total of 508 positive cases have been identified. You'll be glad to know out of these, 429 positive cases have been linked to DOT centers for treatment also. When India's Prime Minister called to eliminate TB in India by 2025, we joined Corporate TB Pledge, or CTP, a joint initiative of the Government of India and USAID in 2019. In the last few years, we have not just been able to make a small dent in this space, but have also motivated other corporates to join the initiative. This, ladies and gentlemen, is the fourth edition of our TB campaign, and I thank you for being here again. For the next hour or so, we will be meeting experts in the area of TB elimination and understanding what is happening and can be done in greater detail. We will meet, for example, Dr. Kuldeep Singh Sachdeva, Regional Director, the Union Southeast Asia. We will also meet Sangeetha Patel, Director, Health Office at USAID India. We will meet Dr. Shivanshu Raj Goyal, the consultant at Artemis Hospital. And for the keynote, we will invite Dr. Rajendra P Joshi, from the Central TB Division. This year, we want to also felicitate grassroots level NGOs working in the space of tuberculosis. And you'll be glad to know not one, but three of these NGOs will be felicitated. The program today will end with the results to the recently held TB quiz for our team members. The conversations will be conducted by Renika Grover, Head of Sustainability and CSR at Apollo Tyres. So before we take a deep dive, let's look at what our heroes, the truckers of India, went through during COVID, and what are some of the ways we have been able to recently support them. This film, ladies and gentlemen, is called Heroes on Wheels.
जब हम स्कूल जाते हैं तो वहाँ पर नई नई जगहों के बारे में पढ़ते हैं, वहाँ लोग कैसे खाते हैं, कैसे जीते हैं, क्या क्या पहनते हैं, मगर मेरे पापा तो उन जगहों को रोज़ अपनी आँखों से देखते हैं।
Over 65% of India's freight is transported on trucks. 65%. But the driver to truck ratio is heavily skewed.
तो यही बोलेंगे इस लाइन में मत आना, इतनी बुरी हो चुकी है।
4-5 घंटा तो सोते ही हैं, बाकी 24 घंटा में 18-20 घंटा गाड़ी चलाते हैं।
रात भर अगर गाड़ी चलाता है, अभी होटल मिल गया तो खा लेता है, होटल नहीं मिलता है तो रात भर ऐसा रहना पड़ता है।
तो अधिकतर कहीं नहीं भी मिलता तो कहीं अपना भी सामान रखना पड़ता गाड़ी में।
Living life by the edge is not easy. It comes with its share of pain and agony and stress and turmoil. There are extreme repercussions of the choices our truck drivers make.
खाने का प्रॉब्लम तो होता ही है, सोने का प्रॉब्लम होता है, नहाने का प्रॉब्लम होता है, सर भी दुखता है.
And they also suffer with a lot of back pain or joint pains as well, and because they don't get healthy food, they have a lot of acidity problems as well.
हमारे पास एक HIV का पेशेंट था जो आया तो उसकी हालत काफ़ी ख़राब थी, तो उसको हम लोगों ने ट्रीटमेंट दिया, ERT सेंटर से कनेक्ट कराया और उसका ट्रीटमेंट 8 साल तक चला. इसी तरह हमारे पास एक TB का केस था. विशेष बात थी वो एक्स्ट्रा पल्मोनरी ट्यूबरकुलोसिस थी, मतलब छाती की नहीं थी, पेट की थी.
But these are daily issues. When the COVID pandemic shocked the entire world in 2019, it had a detrimental impact on the driver community too. Not only were they hit physically as frontline warriors, they were blown away emotionally.
ये कोविड में हम गाड़ी लेके जाते थे तो बहुत दिक्कत आई, ढाबे बंद थे, होटल बंद थे, कहीं पानी की वैसी व्यवस्था बहुत दिक्कत होती थी।
सामान मत दो, पानी मत दो, गाड़ी रोकने मत दो इधर।
हम लोग को कोई इज्जत भी नहीं करता है ड्राइवर को। हम लोग इतना मेहनत करके गाड़ी चलाता है रात दिन भर।
परेशानी तो बहुत है, ट्रक ड्राइवर का तो बहुत परेशानी है ना। फिर बाहर में कोई लोगों फिर गाली गुली देते हैं, मतलब कोई जिंदगी का कोई भरोसा नहीं है ना।
और रात में कई जगह ऐसा है कि लुटेरे बहुत हैं,
लेकिन फिर भी क्या करेगा, चलना पड़ता है। नहीं चलेगा तो नहीं होगा, तो 2 रुपया कमाएंगे नहीं तो खाएंगे क्या।
These truck drivers are our heroes, the lifeline of India, traveling through nights and tough terrains, yet the heroism that they bring to real life is unsung and uncelebrated.
हमने कहा बेटा ड्राइवरी मत सीखो, सब काम सीखो। इनको अच्छा लगता है, हमको फिर भी डर ही लगा रहता है।
अगर गलती से कुछ बीमार हो गया तो क्या कहाँ पर दवाई मिलेगा।
Life may not be easy for our heroes, our trucker community. But we at the Apollo Tyres Foundation will ensure that we stick by these heroes, support them and elevate them in whichever way possible.
पैसे वालों का तो ट्रीटमेंट हर जगह हो जाता है, गरीबों का ट्रीटमेंट होना मुश्किल है।
With over 1,000 peer educators, 32 clinics across 19 states and dedicated medical teams, we began our journey to honor the silent heroes of the road. With mobile vans, awareness programs, wellness drives, yoga sessions, medical consultation for various ailments our drivers suffer from, including vision care and medicinal support, we began treading the path of being a constant support system for these drivers and their families, our heroes and their families.
बहुत बढ़िया काम कर रही है अपोलो कंपनी भी, ऐसे ड्राइवरों के बारे में थोड़ा बहुत सोचा है।
उधर में सब दवा मिलता है, जैसे सर्दी जर बुखार का और टीबी का और क्या शुगर का। ये लोग वैक्सीन भी लगा रहा है फ्री में ड्राइवर को।
This is the least we can do to commemorate their efforts, their labor, their toil and their sacrifices. After all, heroes like our truck drivers deserve all our respect, and the Apollo Tyres Foundation will always remain committed to their well-being.
যেতিয়াৰ পৰা এপলো সেন্টাৰ আহিছে তেতিয়াৰ পৰা আমাৰ বহুত চিন্তা কমিছে।
एपोलोते बहुत मोर करने हमारे करने धन्यवाद, बहुत बहुत धन्यवाद।
और अब मुझे इतनी टेंशन इनकी नहीं है जितनी पहले थी। अब एक खुशी सी होती है कि हाँ मेरे हस्बैंड ड्राइवर हैं।
नीचे जमीन बहती है, ऊपर ये आसमां भी, धीमी धीमी रफ्तारें ले चलती है कहीं भी। ओ बेफिक्र कदम चल पड़ते हैं यूं, जैसे के हो इन पहियों पे जिंदगी, इन पहियों पे जिंदगी, इन पहियों पे जिंदगी।
Welcome back, ladies and gentlemen. By the way, this film is available on our social media pages. Do please share it when you get a chance. That then was a glimpse into the work we are doing with our favorite heroes, the truckers community and their families. The focus today is, of course, tuberculosis, and our journey towards eradicating tuberculosis has a few milestones I would like to quickly highlight. To give everyone a background, we will first do that. Immediately after that, I would request our special guest today, Dr. Kuldeep Singh Sachdeva, to address us. So, Apollo Tyres Foundation started TB services as a pilot in January 2017, primarily to make the trucking community aware. In the beginning, there were challenges in sputum collection, transportation, and getting test results on same day to start treatment immediately. There were no services available within transport hubs. The government facilities were far from our intervention site. To facilitate TB services, especially testing and treatment at doorstep for trucking community, we established DMCs with government support within transport hubs. There are 13 such centers operational as on date, and we are planning to have these across locations in the next couple of years. In 2018, we signed a memorandum of understanding with the union to get technical support. In 2019, joined CTP as a platinum member, and the same year we rolled out TB services across locations. ATF's work in the TB space was recognized and mentioned in the best practice compendium released by Ministry of Health and Family Welfare in August 2020. The union upgraded our CTP membership from platinum to diamond in 2020, and to intensify TB case identification, we started a TB-free transshipment location campaign in September 2020, and in March 22, the 4th edition of the campaign is going on from the 1st to the 15th of March. We've just done that across 32 locations. In September 2020, we organized the Gujarat state-focused virtual event PAcT, Partnership Action Against Tuberculosis, to mobilize and sensitize corporates to join a corporate TB pledge initiative in collaboration with CII, Gujarat Chapter, USAID, the Union, and FOCIA, the Federation of Kutch Industries Association. Edition 3 and 4 of PAcT were organized in March 2021 and September 2021, respectively. This time, the focus states were Andhra Pradesh, Tamil Nadu, and Maharashtra. As on date, Apollo Tyres Foundation has mobilized around 15 corporates who have joined the CTP initiative. In December 2020, we also started the awareness on tuberculosis among the community surrounding our manufacturing locations. In November 21, we started TB services for Apollo Tyres employees from Kerala manufacturing location and engaged peer volunteers in TB services for awareness, referring presumptive cases for testing and for follow-up with confirmed cases. Just to give you some data, the total people we've been able to reach out through our awareness activities are in addition of 500,000. The number of DMCs is 13, number of TB testings that we've done is above 11,000, close to 12,000, and the number of TB confirmed cases that we've been able to identify is above 500. What is really encouraging also is that a total of 429 of these have been finally linked with dots for treatment. This journey is just starting for us, and our commitment towards a TB-free India is what really inspires us to do more and do it every day. Our special guest today, ladies and gentlemen, is Dr. Kuldeep Singh Sachdeva, the Regional Director, the Union Southeast Asia. Dr. Sachdeva is a chest and TB specialist and a public health expert with over 80 papers published in scientific journals. With 32 years of public service, Dr. Sachdeva has played an important role in strengthening health systems, promoting public-private partnership in TB control, supporting TB collaborative activities with HIV, tobacco, diabetes, pediatric TB, and the scaling up of programmatic management of drug-resistant TB. He also led the initiatives in environmental health, patient safety, and vaccines. More recently, Dr. Sachdeva held the post of Deputy Director General Program Manager, National TB Elimination Program for the Ministry of Health and Family Welfare. He has also worked for the National AIDS Control Organization to control AIDS and HIV infections, for the Global Fund Country Coordination Mechanism, and India COVID-19 Emergency Response and Health Systems Preparedness Package as a nodal officer. Dr. Sachdeva also oversees program activities, development, funding, and implementation of strategic plans in his current role, as also participates in driving the advocacy strategy on all policy issues. Ladies and gentlemen, please welcome Dr. Kuldeep Singh Sachdeva. Welcome, Dr.
Thank you. First of all, thanks for organizers for having me in this meeting. Many thanks to Apollo Tyres Foundation also for supporting the National TB Elimination Program, the Union, USAID, and other partners who are working towards TB elimination in the country. Today is an important event which marks, we are talking about Partnership for Action Against Tuberculosis. While we work with the engagement of corporates in the TB elimination program and urge them to sort of devote their resources in the TB elimination program, at the same time, we need to develop the parallel service delivery mechanism for the communities and the civil society for us to realize our dream of TB elimination. While resources can come from our partners, corporates, etc., the on-ground implementation will be done by some by the national program, most of it by the civil society and other partners, because this is what additionality the national program is looking from the partners like us and the foundations like Apollo Tyres Foundation who are supporting in the TB elimination program. The civil society, till date, the role of civil society in TB has been acknowledged to a great extent, but recognizing its potential, it's still very limited. We don't have many civil society organizations working for TB elimination, while there are a host of other organizations who work in areas of health, education, and many other service delivery areas that are yet not involved in TB elimination. So there is a huge need to capacitate them, bring them on board, and sort of they are able to engage with them. We are doing same through various mechanisms. One such mechanism which national program also launched was the concept of a technical support unit. So there are state technical support unit, there is a national technical support unit. We at the union are also have a secretariat which is called Corporate TB Secretariat, which engages with both public sector and the private sector, corporation, foundations, civil society to contribute towards TB elimination. We are at the same time also capacitating the civil society, the foundations and the corporates to deliver those services. So, and we have developed sufficient in-house capacity to do that. We can also help civil society to come up with proposals, scan their proposal and give them technical guidance in this regard. All in all, there is a huge scope of non-governmental organizations, community-based organizations, and other even for-profit organizations in strengthening and working towards TB elimination. We also sort of bring together a platform where we recognize the brilliant efforts by corporations and civil societies and corporates, foundations who have sort of done a substantial contribution to TB elimination. We recognize here the efforts of Apollo Tyres Foundation in this regard. And we are also sort of a focal hub for all the partners to rally together on TB through our various projects. So till date, almost more than 150 corporates and more than 100 civil society organizations are rallying together at the union to support National TB Elimination Program. So with these words, I'll stop here and look forward for a feedback. Thank you.
Thank you, Dr. Sachdeva. That was wonderful of you to have addressed us. Ladies and gentlemen, TB elimination requires action and not just words. Like Dr. Sachdeva mentioned, this will also take all of us to do all this work together, the government, civil society, and corporates to work together. So I really thank Dr. Sachdeva for highlighting those kind of things. Ladies and gentlemen, may I now invite Renika Grover, Head Sustainability and CSR at Apollo Tyres Limited, for a fireside chat with our special guest, Sangeetha Patel, the Director of the Health Office of USAID in India. So we can explore what can be done and is being done in this area. A quick summary and background on Sangeetha first. Sangeetha Patel is a US Senior Foreign Service Officer that assumed the duties of Health Officer Director at USAID India on 31st of July 2019. Prior to this, she served with USAID in Pakistan, Zambia, Armenia, Namibia, and Washington, D.C. She has worked with USAID since 2000 on programs to promote health and education, strengthen health and social protection systems, further humanitarian assistance, and reach vulnerable populations across the world. Before USAID, Ms. Patel worked with the Carter Presidential Center's Global Development Initiative, the Center for Disease Control and Prevention Special Pathogens Unit in Atlanta, as well as the Peace Corps and German Development Organization in Madagascar. She has a MPH in maternal and child health from Tulane University, a BA in French, and a BS in biology from Pennsylvania State University. Ladies and gentlemen, please welcome Renika and Sangeetha. And Renika and Sangeetha, this is your time now.
Thanks, Vineet. This is our time now. Yes, it was indeed a quite informative session before to have a bird's eye view in terms of trying to understand what's happening in the domain of TB elimination. We do know the journey is really, really long and an arduous one as well. Well, next I have the privilege of introducing our special guest who needs no introduction, Ms. Sangeetha Patel. She is a US Senior Foreign Officer and also taking the position of Health Officer Director at the USAID. She has extensive experience across the countries, Pakistan, Zambia, Armenia, and US. And she is also holding a master's degree in public health. We're ecstatic to have you over with us, Sangeetha. Thank you so much. A very warm welcome to you. And once again, thank you on behalf of Apollo Tyres Foundation to actually be, coming for this session. Thank you.
Thank you.
So I just kickstart, being conscious of the time. So I just, Sangeetha, we hear about tuberculosis being one of the major public health problems in India, contributing a significant percentage in the global burden. And when we talk about this, we know that the incidence rate of tuberculosis is 192 cases per 100,000 population, which isn't in comparison to other countries, it's still, we can say it's quite significant, but yeah, it's not the topmost, but we still need to do a lot of work. And we're also aware that the government is doing tremendous amount of work in this area, such as providing DOT facilities and portal Nikshay, which is to support medicine dissemination, nutritional support efforts, and so on. There's so many other things that the government's bringing in. But also we equally conscious of what the corporate sector is doing. The recent transition of the corporate sector joining the bandwagon in terms of fighting against tuberculosis is huge. They understand that easily it can penetrate in their business supply chain as well and disrupt their operations. However, there are still quite a few corporates, which I'm sure you will agree with me, who are still oblivious of the growing concerns from tuberculosis, who still perceive this is something which is a neighborhood problem and it's not something which is exceptional or which can be in their business processes as well. So my first question alludes from there. I know that there is this corporate TB pledge, which is going on, a joint initiative of Government of India and USAID. And you've mobilized over 150 companies to partner in this elimination program. Can you tell us a little about how your overall experience and journey has been with the TB pledge program? And how do you think corporates can collaborate with local governments to improve this TB elimination? Over to you.
Thank you so much. Thank you so much for that question. And I have to say that from USAID, we're extremely excited to be able to partner with the government of India and really think of innovative ways to work with the private sector. The corporate TB pledge is really one of those means in which we found ways to really motivate and energize and really look at companies that are willing to invest in TB and actually think in terms of long-term economic and even workforce productivity. It makes business sense. It's something that was highlighted at the World Economic Forum. But what India is actually doing here in at least across the country with the corporate TB pledge is a model for other countries as well. The corporate TB pledge represents a partnership between the government of India, USAID, as well as over 150 corporates that are willing to invest in the people, not only that are working for them, but even in the communities surrounding them. And it basically is a message from the corporates that they care, that they're not just interested in the bottom line and return on, productivity, but that they actually want to ensure that there is a work and life balance, and that there is true commitment in being able to ensure that these companies care for their corporates, they care for their citizens, but they also want to be able to support their families. I think that when one corporate starts in this manner and ultimately is a model for others, it becomes a movement. And I think that underline is really what we're excited about. And we hope that that contributes to a much greater awareness and movement, not only in India, but even across the world. Corporates definitely must not only be able to support these kinds of innovations, but also think in terms of using technologies and really adapting innovative means, even in areas such as supply chain management or even in information, to ultimately be able to spread awareness, but also action. I think it's why we've partnered not only with them, but also the Central TB Division to really be able to ensure quality of care and support.
Thank you. I mean, it is certainly heartening to know that there's so much work that's happening, and we're also excited about your partnership with the government, because obviously we're at Apollo Tyres Foundation also are trying to work in similar capacities with yourself. Definitely, you've kind of pointed at the right, you've touched the nerve at the right place, because when you're talking about not making more of a business sense, it's actually true, because in the growing sphere where India is, ESG, which is environment, social governance indicators, have taken the prevalence, taken the center stage, where companies, forget about companies, investors, communities, they're not just looking at, just not looking at the returns on investment, but there is a larger message to look at care for society, which is what you've articulated very, very well just now. And you've also mentioned in terms of what USAID is doing. I mean, of course, we're very well aware of what work's been happening and, how you've mobilized. Is there anything that you would like to highlight in terms of how you've managed to get the corporates on board as well? Because what we see still is there are still very few corporates, or there is a long way ahead of us where we need more to join. So is there something that you would like to highlight on that area, that front, where we need more corporates to come on board, where we need more corporates to join the corporate TB pledge, but there is certain kind of challenges that are coming in between?
Absolutely. I think that from my perspective, it's not enough to have policies in place that really mandate that support be provided. I think that it's ultimately when you have visionary leaders within corporations that understand the impact that TB can have. Maybe they felt it personally. Maybe they're role modeling that this is what my company or organization wants to be known for. But ultimately, these same organizations also do need support. They need a plan, they need to have the timelines, and they need to also ensure that they are able to reinforce not only awareness and screening and diagnostics, but also even the follow-up support that's needed for care, for adherence, and also for treatment. And I think it's this kind of robust plan that really looks holistically at providing support, but also looks at existing resources that are available within communities. That kind of allows corporations to then be able to fulfill that commitment and ultimately realize it in implementation. I think that once we start with several and we keep moving, there's nothing stopping us from having a success in this area.
Great. So I totally agree with you. Resources has always been a challenge. To have a robust plan is something to start with. And what I believe that is one of the ways where when we can look at having robust plan, reinforcing awareness, actions, and adherence. These are the key messages that we need to push, towards corporates as well to take on this. In terms of overall, when we look at the goal of tuberculosis, the elimination goal is 2025, which is 5 years before the government's SDG, before the SDG target of 2030. So the government's expectation is that we will be eliminating tuberculosis by 2025. In your view, after being in the sector and working extensively in this area, how optimistic are you that India is ready to achieve its goal of eliminating tuberculosis by 2025? And what actions are required to achieve this national goal? If you could just highlight something on that. Maybe you could kind of dovetail it with the work that USAID is doing in this area.
Absolutely. Thank you. I think that the government of India has taken tremendous strides in ultimately setting a vision under the Prime Minister, but also really across the country to eliminate TB. And at each state level, there's been tremendous effort to really look at what's going on, what more needs to be done to improve case notification, but also how do we look holistically at patients in communities and in facilities and ensure that we can support treatment adherence, but also ensure that we get more people into this caring loop so that we can see them to the end, to elimination, and to ensure that they're also champions in their communities for others. USAID has certainly been a proud supporter of the government of India in this plan, but I think it's truly been a partnership. We've learned from each other, and what I really appreciate is that those lessons learned in being able to raise awareness, being able to really ensure early detection, being able to get at diagnostic support and strengthen supply chains, and even reduce the cost of treatment by partnering also with the private sector. All of these ways have allowed us to work very creatively with the government, but also at the state level. And I think this is what matters, is that when we have a shared vision, a shared commitment, and shared implementation strategy down to the state, district, and even sub-levels, that's where we can be able to ultimately achieve success. So in answer to your question, I am very optimistic. I know that, many people say this is 5 years ahead of where the rest of the world is, but then I think that that is really a reflection of India and of the commitment it makes, not only as a leader, but also ultimately within tuberculosis and really caring for its people.
Thank you. I mean, I like the aspects of shared vision, shared commitment, and shared implementation, because that is the basis of starting this. And you very rightly said that it is a very optimistic target. And there are lots of skepticism in terms of how we would achieve that 5 years ahead of time. But one of the things that you've mentioned in terms of the shared collaboration is the key towards it. And your collaboration with the government is not only appreciated at your level, but it's also appreciated at our level, given the fact that we are one of the implementing organizations as well. So we kind of know how much hard work USAID is doing in this area. So we really appreciate that as well. And in terms of, yes, you rightly said about the champions, because if one of the ways to push elimination is to have champions from the community. And we're very mindful that is something that USAID and other organizations in the space are pushing to have as well, because that is one of the ways where you can create awareness. As they say that for any kind of health condition, one particular area is awareness, and precipitous interventions are not going to work at all. We need kind of prophylactic measures. And this is one of the things that we're looking at, is so where we can create absolutely amazing amount of awareness within the communities. It was very heartening to hear that we, from yourself, Sangeetha, that we're still very optimistic that we're definitely, we're there, we're nearly there. We have to, of course, push ourselves a little more to work towards this particular goal. And of course, partnerships is definitely the key, which most of the corporates, even yourself, you've been highlighting in terms of how we can have collaborative efforts, even SDGs for that matter. When we look at the SDG 17, it talks about partnerships. So on that note, thank you so much for joining and to inspire our attendees today to talk, to know what, where exactly what is the work that you're doing in this space. And we're really appreciative of this. And thank you once again for joining this. It was really, really nice for you to have attended and, keep supporting us.
Thank you as well.
Thank you, Sangeetha. Thank you, Renika. We loved hearing about the TB pledge and how USAID with the government of India is mobilizing partners. Also, it was interesting to hear your views on how 2025 goals can be achieved, even though they are extremely tough. Thank you again, Sangeetha, for the work USAID is doing in India, as well as your personal commitment to eradicating TB from our country. Ladies and gentlemen, we now have another interesting chat coming up when Renika talks with another expert and special guest today. TB isn't new, like we know. The challenges are not new, but they are unique for India. Our next guest is Dr. Shivanshu Raj Goyal, who's currently a consultant respiratory pulmonology and sleep medicine at our Timis Hospital in Gurugram. A little about Dr. Goyal. Dr. Shivanshu Raj Goyal is a practicing pulmonologist by profession and is armed with impeccable qualifications and astute diagnostic abilities. Being born in a family of doctors, he wishes to carry forward the legacy set by his father, Padma Shri Professor Dr. P.R. Goyal, who was once a physician to the President of India, of service to society as his sole motive, and is always willing to share his knowledge like he's going to do today and rich experience with his peers. With various laurels to his credit, such as the gold medal in pulmonary medicine, Rashtriya Gaurav in Medicine 2015, Dr. C.N. Devinangam National Best Paper awarded, as well as a winner of top 3 pulmonary teams of South Asia by the British Medical Journal. He is not just qualified in pulmonary medicine and tuberculosis, but also has special training in sleep disorder and respiratory immunology, allergy testing and management too. Talking today with Renika Grover and uncovering the challenges India faces towards TB control and elimination. Please welcome Dr. Goyal, and over to you, Renika, and welcome Dr. Goyal again.
Greetings. Today we have Dr. Shivanshu Raj Goyal with us, who is going to be present with us for a fireside chat. At present, Dr. Goyal is a consultant interventional pulmonologist at the Department of Respiratory Critical Care and Sleep Medicine at Artemis Hospital, Gurgaon. He did his residency in pulmonary critical care and sleep medicine from Safdarjung Hospital. He's also actively involved in teaching and training of postgraduates in the field of pulmonary medicine at Sir Gangaram Hospital, New Delhi. He's a member of National Academy of Medical Sciences, New Delhi since 2017. During his career, Dr. Goyal, he's earned quite a few prestigious accolades. One of such is the Best Upcoming Pulmonologist Award in North India 2020 from State Minister of Health and Family Welfare, Government of India. Dr. Goyal, we really appreciate your time. Thank you so much for joining this fireside chat. I'm sure our viewers are going to learn a lot from this, and you're going to provide us absolutely extremely informative information. Before I start, I just wanted to kind of give a bit of a context. I mean, of course, this is known that India bears a disproportionately large burden of tuberculosis, with accounting nearly 26% of global burden, where with upwards of 1,200 Indians daily dying from the disease. And when it comes to MDR, which is the multi-drug resistant tuberculosis, we contribute nearly 1/4 of the global burden. So we do know that TB is deadly, but it's also curable. So my first question to you alludes from this. Why is that TB such a challenge in India? And with the pandemic in the last 2 years, has this affected the diagnosis, treatment of TB in our country? It'll be really nice if you could just give us some kind of anecdotal information as well on this.
Thank you, Renika, for having me here, and thank you for this introduction. And I'll tell you, I'm equally happy to be around and share whatever I can with my audience. So, as you rightly started the ball rolling, TB is a problem which we are faced and the entire face of earth we are facing, and we contribute to a huge burden of TB because of our population. Now, if I have to answer your question, like why is TB such a big challenge in India, we have to go back a little bit and understand that the overall scenario of tuberculosis in India is divided into three phases. The pre-independence phase, where there was nothing, no chemotherapies available, hardly any X-rays being done. Post-independence period, where the programs of tuberculosis control were being established, and the present time when we have got everything in place, the programs are being run, and the program of India called DOTS is one of the fastest growing programs all over the world, which covers the maximum population. But we still face challenges. The biggest problem being the poor primary health infrastructure in the rural areas, the private infrastructure, the private clinics, unprecedented, irrational use of first and second line drugs, the growing burden of HIV AIDS in India. We as a global village, we have both kind of population. We have got a population which is affluent, we have got a population which is middle class, and we have got a population which is below the poverty line. We have to understand we also are the diabetic capital of the world. Diabetes contributes hugely towards tuberculosis. Keeping all these factors in mind, the most important part is a political will. The political will has to go in the right direction to understand whether we are how much serious we are to control this problem. Now, coming to your next part, has COVID-19 affected the TB control program? Absolutely, without any doubts. COVID-19 has absolutely derailed whatever progress has been made over the last 12 to 24 months. The amount of progress with the TB control programs have been having over the last decade has been derailed, if I can say so. First time in the whole decade, in 2020, we saw an uprise in the amount of TB deaths as in comparison to any previous year. Why was so? The entire focus was towards COVID. People, all the TB workers were employed or were deployed into the COVID-19 work. There was problem in transporting sputum samples. There was problem in transporting reports. India still relies heavily on paper-based, smear-based reports. All this put together, we have a huge challenge where we are having TB at one of the highest burdens, as you rightly said, that we constitute almost one fourth of the MDR burden of the world, and COVID-19 going along with it.
Thank you. You've very rightfully highlighted some of the comorbidities as well, which is actually attributing towards the surge in tuberculosis. And in terms of, it's a very interesting anecdote to note that in the last decade, that's been absolutely for the first time, there's been a surge in the cases for the first time when we compare from the last decade. But when we look at the awareness levels in terms of what's happening, the current status of tuberculosis, where do you see the awareness levels in India? I mean, I do know that, you've highlighted about MDR as well, and you've highlighted about diabetes, you've highlighted about people living with HIV, AIDS, and other comorbidities. Where do you see in terms of the awareness levels within our communities with regards to tuberculosis?
I would say that, the awareness level has been fairly high, because of the involvement of hospitals, doctors, NGOs, government bodies, paper campaigns, ad campaigns, different celebrities getting involved into this cause. So people have had a fair knowledge about tuberculosis, but still when we talk about MDR, if I can say, it's a multi-drug resistant tuberculosis. Not many people still know about it. And if I can quote by the words of Sir Crofton, who has done the maximum work in tuberculosis, he says the worst thing we can do to somebody is to convert his normal TB to an MDR TB. Because once somebody is a multi-drug resistant tuberculosis, he will spread an MDR TB to the other person. So those kind of awareness levels are still lacking. People still think that if there is TB, it only means lungs. No. Let me, by the means of this program, let me spread this knowledge. TB can affect every part of your body. You can have TB of your bones, you can have TB of your skin, you can have TB of your every body part, including your abdomen or your reproductive organs. So never think that if you're not coughing, you do not have TB. Most important awareness in terms of the treatment part, apart from diagnosis, is the completion of treatment, which people do tend to take lightly. They start the treatment, they feel they have recovered, they stop their treatment. It is our work as doctors to make sure that we go ahead and we make people complete their entire course. A complete treatment is the way forward if you're looking at anyway being close to ending this problem.
Right. I guess, I mean, you've very rightfully highlighted this, because one of the significant challenges with us also, given the fact that we work in with the mobile population on tuberculosis, it's one of the key challenges, and rather I would say it's an uphill task to ensure that the drivers community, the truckers community actually complete their course. And that's one of the reasons I believe that we're only one of the organizations, so to speak, working across the country with a mobile population on tuberculosis. Having said that, you've just wanted to know some of your viewpoints. You've highlighted, of course, that completion of tuberculosis course is really, really essential. Could you reflect and provide us with the top 3 actions that can be done, that can be taken to control and eliminate TB completely? And if I do realize that since you're working with Artemis, you could actually highlight or maybe dovetail some of your work at Artemis, that would be grateful for us.
First of all, let me give you all cheers for the appreciable work which your organization is doing for the truckers. These are the population, they are very difficult to trace because they're always on the go. And the other part is this population sadly is also one of the highest populations suffering from HIV. And HIV, TB, once they are together, there is 20 to 30% higher risk to these people. So absolutely phenomenal work which you people are doing for these people. Now, what you have asked me that what work, how we have been doing at Artemis. At Artemis, Artemis being a tertiary care center, it's a referral center. We get patients not only from the local areas of Delhi NCR, we get patients all over India. We even get patients from out of the India. So we get international patients as well. So it is our work, and it has been ingrained among us, because we being from the pulmonary medicine field and my medical schooling being from the southern part of India, where we have worked extensively at the National Institute of Research in Tuberculosis, Chennai. So our entire focus is towards diagnosing early. As early as possible, we make a diagnosis. Do not delay the diagnosis. Start the treatment. Make sure these patients complete their entire course. During the course, if they have got any problems because of the TB medicines, we do cater to those problems. And we have made whatever best contributions we can. We have done collaborations with different NGOs, one of them being the JEET organization, which we call as the Joint Effort Against Elimination for Tuberculosis, where even the TB drugs are given free of cost to our patients, irrespective of their financial status in the society. You can be anybody, but you will still get free drugs. You are given free testing, not even the smear level, but even the genotyping level. The gene expert tests are also being done free of cost. All this is being done parallelly by a workforce, and they call the patients, they find out how they are going. If they have not turned up on the specific date of follow-up, they are being called specifically for a follow-up so that we do not miss any case. All cases, once diagnosed, whether it is a lung TB or an extrapulmonary TB, they're all notified. They're all notified on a portal of the government called the Nikshay, which is a portal of app available by the government of India. And we notify these patients. Every patient gets notified, and they get financial support from the government as well, so that there is always an impetus for them not to stop their treatment, at least from the financial point of view.
Yeah, I realized Nikshay and the government's support towards elimination of tuberculosis is huge. And we've also been trying to close the loop, because I believe it's 500 rupees a month is what the patient receives in terms of what, from the government, which isn't.
Oh, sorry. Please go ahead.
I said, which isn't really significant, but it's really useful at the moment, because for tuberculosis, as you rightly said, it's the completion of the course, and nutrition is one of the key components together with it. So it's one of the key areas which the government could have supported, and it's going pretty well. Sorry, you were saying something, Doctor.
No, I was just about to say that, whatever amount, the amount is just an idea, it's because there's so much more what we can do, exactly what you pointed out, the nutrition level. These people do not care about their nutrition. We make sure that these patients are getting adequate nutrition. And even when we say about diabetes, we have a program, all TB patients mandatory undergo an HIV testing and a diabetes screening. So these two problems, one screen from a patient's body, we are very certain if they complete the course, we'll be having a happy patient at the end of the day, and they will not spread to anybody else. That's the idea.
So I was just listening to yourself. So the 3 action points which you've categorically stated would be diagnose, start, and complete your treatment. That's the first one. The second one is overcome all the challenges, because one of the key areas is to ensure that the person overcomes all the challenges during the treatment and finishes it rather than converting into MDR, which we've highlighted. And the third one, which is again the most key one, is collaborations, because the collaborations is the way forward. Silo working is not going to work. It's enhancing the infrastructure and medical support to ensure there is elimination of tuberculosis. So I guess that's what you were saying, which is absolutely great. My last question to yourself would be in terms of, in your opinion, because given the extensive work that you've done in this area, in this domain, how realistic do you feel is the goal of 2025 elimination of tuberculosis, given the fact that this goal is 5 years before the SDGs, which is by 2030? How realistic do you think this goal is, and when will we begin to turn the corner on this trend and see India as a TB-free India?
Okay, now if you ask me very frankly, I would say it's an ambitious goal at this point of time. Because of the COVID-19 pandemic, we have got a certain derailment of the entire program. Realistically, I would see, yes, we should not get demotivated, and we should not think that we cannot do it. But 2025 might be too early of an ask. But yes, 2030 definitely sounds realistic. If we work towards the same point, everybody, this year's TB Dray program's theme is to invest into TB to save more lives. The idea is to collaborate more private partnerships. And I would like to stress upon one point. We have to move away from paper and smear-based reporting. We have to go towards the genotype-based system, fast reports, early reports, and make sure that we get the reports of the drug sensitivity testing very fast. If we do 2 things, diagnosis by a gene expert and the drug sensitivity testing as early as possible, we'll be able to catch hold of a problem before it converts to an MDR. Or if it's an MDR, we treat it like an MDR. If all these things are done, and as we pointed out in the previous section, active early case finding, we should be on our way to end this problem from our country, and we should have a country free from the last patient of tuberculosis. If not 2025, at least by 2030, we should be able to achieve this goal.
Well, that's definitely a difficult ask and a difficult one but nevertheless, it's not difficult to achieve, I would say. 2025 is an aspirational vision, and 2030 is something that you feel that is more doable, given the infrastructure, given what we have currently available. Yes, collaborations is an integral part. It's most important. It's crucial to ensure that we reach the elimination goal. And one of the points that I liked about your conversation earlier when you were talking about is in terms of the DOT services, is the fastest growing program. These are the areas which is telling us that it's not something which is not attainable. It is attainable, but we just need to ensure that we have strategic partnerships, we have strategic collaborations to reach the goal of 2025. With that, we've nearly come to an end of our insightful session, Dr. Goel. Thank you so much for joining us. It was indeed a pleasure to have you over here as our esteemed panelists and for providing information to our viewers. With that, I'd like to, sorry, you wanted to say something, Dr. Goel?
Thank you so much for having me, and
Okay.
I'm always happy to share any knowledge possible from my side.
Absolutely. Thank you once again, indeed. With that, I'll formally close this session, please. Over to you, Vineet. Thank you.
Thank you, Dr. Goel. Thank you, Renika. Ladies and gentlemen, we all heard that India contributes heavily to TB in the world, almost 25% of all cases. Dr. Goel, thanks for the insights, how DOTS is growing, as also the challenges in our health system, the link between diabetes and TB, and the need for political will, which we can see in the country now. COVID has also, you told us, derailed some of the work done in the area of TB, which is kind of sad. Completion of the course to cure TB is vital, and we thank you for highlighting all that. Also, your words, diagnose early and complete the course, will stay with us, and I'm sure it will stay with the audience. Thank you again, Dr. Goel. Now, moving on and introducing our chief guest today, ladies and gentlemen. Our chief guest today is Dr. Rajendra P Joshi of the Central Health Services, Ministry of Health and Family Welfare, Government of India, and is currently the Deputy Director General of TB at the Central TB Division, New Delhi. A distinction holder in 4 subjects from Government Medical College, Mysore, Dr. Joshi went on to get his DNB in '93 and a postgraduate diploma in maternal and childcare in 2000, along with many other qualifications. After being selected for Central Health Service through UPSC in '87, Dr. Joshi has had an illustrious career. WHO Fellowship, member of Ministry of Health think tank, trainer for the Indian Medical Association, Seva Ratna. Dr. Joshi has published also for various respected journals. He's known for his talks on health and lifestyle management, diabetes, prevention of heart attack, etc., and is a regular on AIR and Doordarshan. But what I do know is that Dr. Joshi is passionate about improving healthcare delivery in the government sector. Ladies and gentlemen, please welcome Dr. Rajendra P Joshi.
Good afternoon all. I thank the organizers for giving me opportunity to participate in this very, very important webinar. Apollo Tyres Foundation and all the NGOs together have done a great work in the last few years, and I am happy that this year also they have done 2 weeks of active case finding across a huge area, 19 states and 32 locations, and that too in a very, very important and vulnerable community of truckers and other drivers. So I am grateful to Apollo Tyres for this initiative and looking forward to their continued involvement in the program. National TB Elimination Program recognizes the crucial role the corporate sector plays in the elimination of tuberculosis from our country. India has got an ambitious goal of eliminating tuberculosis by 2025, and we recognize that each stakeholder involvement is very, very important, whether it is the corporate sector, NGOs, community itself. They are all very important stakeholders in this important goal of achieving the elimination of tuberculosis from our country. So I congratulate the Apollo Tyres Foundation for doing a great work for the last few years and their continued support in the coming years also. I also understand that today many NGOs are being felicitated for their involvement in the tuberculosis work. This is a very good initiative from the Apollo Tyres Foundation, and I extend my congratulations to all the people who are getting felicitated today, whom I sure they richly deserve. Tuberculosis is one infective disease which spreads from person to person, and it can be easily prevented, easily treated, and we have got very good medicines which are freely available from the public sector. What we require is the awareness at all levels, from most educated to the least educated, from the rich to the poor. Everybody needs to be aware of the common symptoms, everybody needs to be aware of the facility available, and everybody needs to take the treatment fully for the full course. With treatment adherence and correct medicines and diagnosis, the cure rate is excellent. So the involvement of all the NGOs and corporate sectors is very, very crucial in filling these gaps of creating awareness, creating health-seeking behavior, and doing the active case detection for the people who are very busy in their day-to-day life. So this initiative of traveling across the locations and detecting people is truly appreciable. So I again thank the Apollo Tyres Foundation efforts towards organizing this webinar and recognizing the NGOs and civil societies who are passionately working towards this goal. With all your support, I am sure that we will win the race and make India TB free. Thank you.
That was Dr. Rajendra P Joshi, ladies and gentlemen, the Deputy Director General, Central TB Division. Thank you for that wonderful keynote, Dr. Joshi. Ladies and gentlemen, as the nation gears towards achieving the ambitious goal of achieving the Sustainable Development Goals towards ending TB by 2025, community ownership is the need of the hour. Such people movements in the past have witnessed an unparalleled contribution by civil society and NGOs. Like corporates can support the program through their reach and resources, civil society and NGOs can play a vital role in implementing the program at the local level more effectively. At the start of this program, we mentioned the outstanding on-ground work done by NGOs. We at the Apollo Tyres Foundation would like to acknowledge and applaud 3 such NGOs and felicitate them for their great work. These NGOs went through a selection process and more than 40 NGOs applied online. 10 were shortlisted in the first round, and finally 3 were selected by the jury. The jury had a simple selection criteria. They were looking for grassroots level NGOs working in the space of tuberculosis eradication for at least 2 years. The total number of people these NGOs had reached out to through TB intervention, and finally the impact they had through TB intervention and the number of TB champion or survivors working in the projects. It gives me great pleasure to announce the shortlisted NGOs. The first NGO shortlisted for its outstanding work, ladies and gentlemen, is Touched by TB, the National Coalition of TB Survivors in India. Touched by TB was formed in the year 2018 when REACH organized a South Asian Regional Capacity Building Workshop at New Delhi. During this conference, the Indian participants realized that in many countries, the survivor networks closely works with the state TB program in making improvement. Post this workshop, Touched by TB was formed and started working across the country with its vast membership base. Today, they have reached out through TB intervention to more than 10,000 people. To give the first award away, ladies and gentlemen, may I please invite Sangeetha Patel and Renika Grover to present the award to Touched by TB and to present it to Dr. Raghavan Gopakumar, the governing board member and national coordinator at Touched by TB. Next up, ladies and gentlemen, is Blossom Trust. Established in 1993, Blossom Trust promotes women-led development and community resilience through network, capacity building, skilling, and awareness raising. The organization operates across Tamil Nadu in different areas, including supporting communities living with HIV/AIDS, TB, and diabetes to achieve greater access to care. Representing Blossom Trust today is Mercy Annapurni, Managing Trustee and Director of Blossom Trust. May I request Sangeetha and Renika to do the honors again. And finally, Alert India, Association for Leprosy Education, Rehabilitation and Treatment, Alert India. 40 years of experience in rural, tribal and slums of Maharashtra. Alert India has reached out to 15 million people, ladies and gentlemen, and has directly impacted more than 400,000 lives. The organization has specialization in community-based disease prevention, control, policy advocacy, and healthcare for community affected by neglected tropical diseases. The organization also works with TB awareness, screening, testing, and nutrition support. From Alert India today, we have Prabha Mahesh, Project Director Health, receiving the award, and as usual, Sangeetha and Renika are giving it away. Congratulations, Touched by TB, Blossom Trust and Alert India. We are proud of the work you are doing and wish you all our very best. May I also request all the 3 award winners to come on screen for a photo with Sangeetha Patel and Renika Grover. This, I think, is the best we can do in digital times till we meet personally. Please. But before we end the awards section, we have all the three awardees talking to us about their work and showcasing their expertise. Ladies and gentlemen, please have a look.
We are working at district level, state level, and national level, and directly, connected with the TB patients to understand their problems and highlighting at the national level to curb their issues. Right now, our champions are, reaching every nook and corner to make TB awareness, and people are aware. And our champions are interfacing the patients, survivors, and Central TB Division for getting their nutritional allowance and other, diagnostic facilities, treatment, supply of medicines, etc. During COVID time, our champions intensively worked with the dot provider to so that the TB patient do not drop any of their medicine during their treatment course.
We have formed this Rainbow TB Forum for the TB affected communities, and we substantially increased the number of new active TB cases in the district. We supported the RNTCP program also. From the year 2022, we are started implementing the Stop TB project under CFCS grant. We are addressing the issue of comorbidity like TB and HIV, TB and COVID, and TB and lung diseases. So we have formed a very good network of TB affected communities, which also represent in the India CCM also.
Our projects revolve right from creating community awareness, PCSM for targeted population, ensuring access and availability for diagnosis and treatment through establishing 8 sputum collection centers and 28 dot centers in the remote peri-urban areas of Mumbai. Treatment adherence counseling, private provider engagement, nutrition for TB patients, pre-treatment evaluation for drug-resistant TB patients for early initiation of treatment, availing social benefits through various schemes, providing free HIV testing and treatment initiation for TB patients, and sensitizing 2,200 private providers to provide free service delivery for the TB HIV patients in private facilities. We have implemented 26 such pilot projects that translated into programs paving way for sustainability by embedding those activities under the public health action. In totality, we have touched over 5 lakh lives through several TB communities.
The more we know about TB, the better we can manage it. Awareness is finally the start of all large initiatives. The more we talk about TB, the more we can help people. Communication is the key. Like Amber Saab says, मुश्किल को समझने का तरीका निकल आता. मुश्किल को समझने का तरीका निकल आता. तुम बात तो करते, कोई रास्ता निकल आता. We ran an online quiz for our employees to check how much we know about TB and its prevention, and I'm very happy to announce the winners. Ladies and gentlemen, please join your hands for Arman Sharma, Executive Passenger Vehicle R&D Chennai, Meenal Malik, Assistant Manager Legal Department Head Office at Gurugram, and Bhavesh Sharma, Senior Executive Industrial Engineering at Baroda. Congratulations to all the winners and best wishes to all the participants. Congratulations Arman, congratulations Meenal, and congratulations Bhavesh. To be able to eliminate TB in India by 2025, ladies and gentlemen, and to support PM's clarion call to do just that, Apollo Tyres Foundation, being a diamond member of Corporate TB Pledge, has actively engaged to respond to TB for the last 5 years among the trucking community, constantly raising awareness, identifying people with TB, assisting in linking them to dots, and serving the most vulnerable. With an estimated 6 million truck drivers in India, the trucking industry represents a notable 2.5% of the most economically productive labor force. Though the Indian trucking sector contributes about 5%, that's USD 55 to 60 billion of the GDP, the truckers often come from poor families and lead miserable and socially marginalized lives. This is the set of people we serve and are committed to. To know more about our work in eliminating TB from India, please do take some time to visit our social media pages. This, ladies and gentlemen, was the 4th edition of Partnership for Action Against Tuberculosis, fondly called PAcT. We thank you for joining us and taking the time to listen to our guest speakers, as also your commitment and interest in making India tuberculosis free. It would be tough to beat TB, but like a poet has said, जहां में हर बशर यानी इंसान, जहां में हर बशर मजबूर हो, ऐसा नहीं होता। जहां में हर बशर मजबूर हो, ऐसा नहीं होता। हर एक राही से मंजिल दूर हो, ऐसा नहीं होता। और गवाहों को तो बिक जाने की मजबूरी रही होगी, गवाहों को तो बिक जाने की मजबूरी रही होगी, हमें भी फैसला मंजूर हो, ऐसा नहीं होता। On behalf of the Apollo Tyres Foundation, see you again soon, hopefully not virtually, as the world opens up and we start to shake hands and see each other personally. Till then, we wish you a good day ahead. Thank you and Jai Hind.